So I got up that morning, got ready for work, felt fine. Came in, and as I was walking down the sidewalk to come in the door, I sort of got, it's almost an overwhelming feeling. It was like if you stand up too fast and you see stars, it kind of felt that way, just magnified. So I remember walking in the door, speaking to Deputy Funk and Mr. Dyer, telling them good morning, came in my room. And when I got into the room, I didn't actually make it to my desk. I sat down at Ms. Hall's desk, put my feet up. I don't know, maybe I thought I could catch my breath that way, but immediately called my friend Monique.
I walked in and she was at our boss' desk, and she had her leg on the desk, and she was just laid back, and she was like, oh, I can't breathe, I can't breathe. I told her to get Nurse Hope, and she wasn't here at the time, so she leaned out the door to let Mr. Dyer and Deputy Funk know what was going on.
I come in, and Amy's not at her desk. She's actually at another desk right inside the door, and she had no color to her. I knew obviously right away something was very wrong. I'm thinking, first observation, she's having a heart attack.
And she was sweating really bad, and she was just, it was almost like it was hurting her to talk because she had to catch her breath in between.
I radioed into dispatch. I have a direct communication to where they can dispatch EMTs to us, and they did.
I remember looking out the back of the ambulance, and there's a cemetery going down 109 before we get to the hospital. I remember seeing it, and I asked, how much longer it is to the hospital, and he told me 6 minutes, and that's when I told him, I'm not gonna make it, I'm gonna die. And I remember him telling me several times, no, you're not. And I don't remember anything else after that.
I heard a code blue called overhead. That's someone has lost a pulse. And I was up in the administrative offices and came down to the ER and saw someone who had just recently come in with an ambulance, and they had lost a pulse, I think 4 or 5 times. And I can't remember, someone told me or saw him that it was a staff member, someone who'd worked in the hospital for a long time, who I knew personally was standing there, and it was his sister. And of course, we want to take good care of everybody. We're also very anxious when there's a critical patient like this, but there's another layer where, oh, it's one of our own.
When I got downstairs, I saw JB, our chaplain, there, and I was unaware of his role in these sort of circumstances. So I was not prepared for the severity of the situation that was going on.
And I remember going down there, and he was pacing outside the room, and I remember taking a look in at his sister who was ventilated, and I looked over some of the docs, and I knew that deep down inside that this was pretty bad, and especially with how many times she had coded. And I remember the doc sitting around and said, can we get her downtown? And I remember one of the doctors said, I don't think we have time for that. I think if we can't get in there and potentially get this clot out, then the prognosis doesn't look good.
The team in the ER, the emergency physician, the nurses down there, the respiratory therapist, were doing the whole 9 yards. So she got intubated, she was getting multiple rounds of medication, they were doing high quality CPR, and all of that was crucial, because if they had said, oh, she's not gonna make it, and had pulled back at any point, we couldn't have got her to the place that they could have removed that clot. With our recent partnership with Ascension St. Thomas, we have now physicians on staff who can do that. And this happened to be one of those situations that the person had just had a cardiac arrest. We had really good evidence that it was likely a blood clot, and had the ability to do that. And I mean, it made all the difference in the world in this case.
I think another special moment with the St. Thomas partnership is, I think, the spiritual side. It's more than, just the healthcare and the physicians, but it has God beside that and behind us, and the spiritual side of taking care of people.
He did more than I could have possibly imagined, stayed with my family, reassured them, prayed with them, and they still sing his praises to this day.
It's us taking care of our community and our neighbors and our friends, and in this case, our co-workers' family. So it's a sense of pride, and it's a sense of realizing how important our role is in the community.
I'm very thankful for Gallatin Hospital, Sumner Regional. It's not far from my house, and I received amazing care while I was there. So I'm very thankful for the hospital and the fact that it is so close to home.